impacting young people today, they all really come down to one common denominator, and that's graduating from high school. If you look at young people over the course of a lifetime in terms of earning potential, health, and the quality of their relationships, there's a clear delineation between kids who graduate from high school, who seem to do fairly well in all those categories, and kids who don't graduate from high school. If you look at the most important skills that young people need in order to be able to graduate from high school, reading by the time a young person's in third grade is paramount. So at the Office of Youth Services, we think it's really important to have programs that help nurture the desire to read in young people, and this is one of those programs. By getting books into the hands of young readers, we are supporting the educational process and hopefully increasing the graduation rate in Manchester.
I was just saying that we do participate in Reach Out and Read, which is a preschool literacy program started at Boston Medical Center, and it's to get books into the hands of kids before they get to school. So we do get some donations for that, and at every Well Child visit, kids 6 months to 5 years get a free book. So this program, this holiday book drive that Barnes & Noble does, helps us extend that, so we get the momentum at a young age, and then they continue to be able to get free new books at least once a year, hopefully even more, that keep the momentum and keep them excited about reading. Oh, it definitely does. I mean, there are studies that show that the earlier kids are exposed. And so there's been a push for several years now to get preschool children, and there's a program where they encourage pediatricians to basically prescribe books for kids, and they encourage the parents to read to the kids. So it does get kids exposed before they get to school, but you also have to continue that momentum. And if you get kids excited at a young age, and then you're giving them books, periodically to keep them engaged and have books in the home as opposed to seeing it as an educational experience. Well, we do participate in Reach Out and Read, which is a national program, started at Boston City Hospital, Boston Medical Center, and that's the program where they prescribe books to kids. So we do, for kids between 6 months and 5 years, at their Well Child visit, they get a new free book. And then the provider talks to the parents about the importance of reading to kids at a young age. So we do that, and then this helps us extend it.
So if there's anything I'd like to say is I certainly want to put a plug out for this program. If you're at Barnes & Noble or any other location where this is taking place and you're asked to donate, please do so and consider what you're doing. You're putting books into kids' hands, which is really so important. So donate if you would. Thank you.
I'm just really grateful that Barnes & Noble does this because, as I said, we don't have opportunities for the older children, and this gives us that opportunity, and it's definitely very much appreciated.
I think that most young people who receive a gift want to feel like it has come to them brand new. There's nothing like going through the holiday season and opening up a present that was picked out specifically for you. The power of this program is that by working with nonprofit associations like the Salvation Army and working with Child Health Services and working with other social service agencies around the city, we're able to collect lists of books that we need for young people, books that they've selected, books that they're interested in reading, and give those lists to Barnes & Noble. The Barnes & Noble patrons then actually buy those books. And in an amazing way, those books get from the purchaser all the way to the child, without the child ever knowing who gave them the book and without the purchaser ever knowing who got the book. I really think this supports the truest of giving spirit during the holiday season.